So for Justine, we're going to treat the tear trough. So just look up the way for me for a second, thanks. So the tear trough is this hollow junction that runs down at the junction between the eyelid and the cheek. Some people develop the tear trough deformity as part of the aging process. Some people are just born with it and that's just their anatomy. But the way that we correct this is by reinflating one of the fat pads below the eye. Now, one of the things that we really need to be careful that we don't do is just fill into the groove, because if you just fill into the groove, it just makes a sausage-like bulge in this area that we absolutely do not want. So I'm going to go into a fat pad called the SOOF, suborbicularis oculi fat, which sits in here below the muscle and below the orbital rim. So we'll reinflate that, and that's going to take away the vast majority of the groove. And then at the end, depending on how effective that's been, I may well put a tiny little drop superficially just on top of the muscle, but most of it's going to happen below the muscle. So the cannula comes in down in the cheek. We get up here, do a wee aspiration to make sure that we've not damaged any blood vessels. Just going to do a really slow fill of the SOOF, and then I'm going to use my finger just to manipulate that and massage it into place. And I'm going to check and see how that's looking. And already, just from that really small amount, we can see that the tear trough on this side is looking less deep than on that side. Already that is looking smoother. I'm going to go back in and do a little bit more, and I'm going to blend it in a bit further down so that we end up with a contour that's nice and smooth. Let's do a wee touch up here. So I'm going to put a little bit superficially in Justine's case, but this is absolutely minimal amounts that are going into the fold itself. Like tiny, tiny, tiny amounts. And just look straight ahead at me. Thank you. And that is us. Good, that's that side done. So the next thing about the tear trough procedure is that it is really quick and easy to do if you know how to do it properly. So a lot of girls are really scared about doing anything beside the eye because they worry about injury to the eye. But actually, in experienced hands, it's a really safe and quick technique. When we do this, it often reduces the appearance of dark circles under the eyes. And the reason that it helps to improve the dark circles is because when there's a groove here, it casts a shadow. And when you take the groove away, it reduces or removes that shadow. What it doesn't do, though, is change the colour of the skin. It's impossible to change the colour of the skin. So if there's dark pigmentation or there's dark discoloration of the skin, you can't change that with fillers. But if there is a tear trough that's contributing to that, i.e. by casting that shadow, then filling the tear trough will also simultaneously improve the dark shadow. So again, I'm just doing a tiny little bit on top of the muscle, just to blend it in and look straight ahead for me. Thank you. And we are done. Ta-da!
Oh my goodness. Wow, that was so quick and easy.
Looks really natural.
Yeah.
We've just blended that junction between the eyelid and the cheek so that that groove isn't there any longer. But it doesn't look bulky, it doesn't look puffy, it just looks
great.
Nice and smooth.
Good night's sleep.
Exactly, that was the look we were going for.
Yeah, brilliant.
Fabulous.